You're listening to IHC's podcast.
Welcome to the IHC podcast, where culture meets community. I am your host, Marissa Hemstreet from the Canyonsito Band of Navajos, and the communications coordinator for the Indian Health Center Santa Clara Valley, where we provide medical, dental, counseling, WIC, and prevention services to over 23,000 members, while specializing in the unique health and needs of American Indians and Alaska Natives. Today, we're here speaking with...
Hi, everybody. My name is Paloma. I am a medical support administrative assistant here at Indian Health Center. My pronouns are her/she. I do not have any tribal affiliations that I know of, and I am from San Jose. And thank you for having me, Marissa.
Yeah, thank you so much for joining. I forgot my pronouns too. She, her, ella, también. So thank you so much for hanging out with us today on the IHC podcast. Today's episode is about health and wellness and advocacy. So, so grateful to have you. What's it been like for you? I know you're a new employee at IHC, and has working at IHC stood out to you as opposed to working for other organizations or maybe even a place that you've interned at?
Yeah, definitely. So like you mentioned, I've only been here at IHC for a few months. I just started back in May. So I'm fairly new, but it's been a very rewarding and enlightening experience. I've come to really appreciate the effort that goes into keeping all of the clinics running smoothly. I participate in a lot of our regular meetings, and my role allows me to support not just Andrea, who is the Director of Clinical Services, but also the clinical team as a whole. What stands out to me the most is how crucial communication is within the team. I've seen firsthand how communication not only streamlines the operations, but also enhances the overall patient experience. And something that has stood out to me about working here at Indian Health Center is that it is the only agency here in Santa Clara County that specializes in the unique healthcare needs of American Indians and Alaska Natives. And not only are the services limited to American Indians or Alaska Native population, but also the greater community. And I think that is something worth knowing about because it's something that I didn't know before.
Yeah, and then a question that we get a lot for folks who are new to the Bay Area or new to San Jose, and they're looking just for primary health care.
Mm-hmm.
They walk in and they're like, is it only Indians, and what kind of Indians?
Yeah.
And so that's always a fun conversation to have with folks, and just reminding them that we're still here, and no, it's not Eastern, Asian, Indian, it's American Indian, Native American folks indigenous to Turtle Island. But it's always a fun conversation, and if anything, I feel like it's an icebreaker because you're like, even when I started as a patient at IHC, that was something that I was confused about too. The only way I knew for sure that it was specifically care for Indigenous folks was because it was listed on the IHS website, the Indian Health Services. It said, if you're a member of a federally recognized tribe or self-identify, that this is a service that was applicable to me because at that time I didn't have health care.
Mm-hmm.
Yeah, so one way to find out about it.
Yeah, definitely.
Yeah, but I like that our tagline is where everyone is welcome, so hopefully that kind of push that in people's mind that, it's not just for Indigenous folks, it's for all folks.
Yes, so come on in. No, I'm just kidding. But I know you also asked me how can I differentiate it from working at other health centers. It's actually my first working experience working at a health center, so I don't really have another one to compare it to, but I can definitely say that it's been a valuable learning opportunity as I attend most of the leadership meetings. Like I mentioned previously, I am able to observe the variety of challenges that arise in a healthcare setting, and it's really inspiring to see the hard work and dedication from all of the medical directors, the clinic managers, and just the staff as a whole, to ensure that the patients are receiving the care that they want or need.
Yeah, well, I'm glad you're able to see that even in our meetings and whatnot. And then I've been a contractor for other organizations like Kaiser and the county and VMC. So even when I get to see their type of care, well, it's great, it's comprehensive for the patients and their patient base. I just like the fact that IHC has that cultural component. It's culturally comprehensive. So, and it, I want to say it's a whole person approach to wellness.
Definitely.
Yeah. And, can you talk us through your role as a medical administrative assistant and explain how you support the medical team and patients?
Yeah, definitely. So like you mentioned, my role is a medical support administrative assistant. It's a lengthy title, but my primary responsibility is to report to the director of clinical services. But I also support the medical team, like other clinic managers or directors. I help keep track of documents, meeting minutes, and action items. And some of the tasks and projects that I've been involved in have provided me the opportunity to collaborate with others, like clinic managers, other administrative assistants, to coordinate meetings, or with individuals like yourself from the communications department. So it's definitely it's a fun role. Your day is never looking the same. You have different tasks, and I really like that because I'm providing support to the leadership, which they're providing support to all of our staff members. Although I don't interact directly with patients, I support the medical team in several crucial ways. I manage administrative tasks that help keep the clinics running smoothly, such as processing mail, creating documents, and maintaining the office supplies at the clinic, specifically the Meridian one. I also help coordinate meetings and training sessions, which enhances communication and collaboration among team members.
That's awesome. Yeah, we need the person to help us make sure that we have everything that we need. So a lot of times we run out of printer paper. It's not that hard. But it's just we're a smaller department, and so we have different work from home days, and so just that communication within our mini 3-person department is like, hey, we're out of printer paper. Who's gonna order it?
Well, if you guys ever need any help, let me know.
I'm all sorry, Hedda, I don't mean to call you out. But that's really cool. And what is your guys' team meetings like?
A lot of our team meetings, there's different clinic team meetings. There's one specifically for Meridian, Silver Creek, the O'Connor location, and the Pediatric Center. And they all consist of, going over productivity and how we can improve productivity. Also reviewing current workflows that we have and how we can improve them so it can be easier for our staff members to follow along those procedures. So they're really informative. A lot of action items that I have to take note of. But I think it's really helpful, not just to the clinic leadership, but also to the staff.
Yeah, and that's cool. You guys are getting an inside look for IHC patients and community members who are listening, because not too often do you get to learn what happens on the back end. You're just like, oh, I'm going to the doctor, see them for my appointment, get a medication or get prescribed some type of referral. But it's really nice to hear about the back end of the work and just how important that is and making sure that the patients get the care that they deserve.
Yeah, definitely.
So,
There's so many different roles too. When you think of working at a health clinic, you'd think, oh, it's just medical assistants and doctors, but no, there's much more. You have your clinic managers, your supervisors, the front desk, the eligibility team, and then like Daniela's team, who is
quality improvement.
Yes,
QI.
quality QI. Yes, QI coordinator, and she has her staff who I believe includes patient navigators. So it's really awesome to see how the whole clinic works as a whole and how we all come together to collaborate with one another.
Yeah, I know. When I started at IHC, one of the things that I thought was interesting that I didn't know existed was QI, the quality improvement folks, because they really take in that data. And this is something, so if you're taking stats now, it's going to apply somehow, some way if you're working in this field and making sure that we get the proper health data. And they get to check health numbers, and they're part of the folks who tell us if there's a mask mandate, if there's not a mask mandate because of COVID-19 or other, viruses out there, and when to get a vaccine, what type of vaccine. So I think that's super important to have, especially as part of a clinic. And, thank you, Daniela Arcenega, for all the hard work that you do. And the QI team, shout out. So how does IHC's approach to patient care cater to the diverse needs of community, in particular, American Indian and Alaska Native folks?
So, Indian Health Center provides comprehensive, culturally relevant care focusing on the needs of American Indian and Alaska Native populations. Their approach integrates physical, emotional, mental, and spiritual health, respecting traditions and promoting well-being. Some of these key aspects include culturally relevant care, which integrates healing practices, involves elders and ensuring cultural safety, holistic health approach, which balances body, mind, and culture with behavioral health, prevention, and chronic care. And behavioral health integration, it addresses trauma, substance abuse, and mental health with specialized services like a pediatric behavioral health clinic that we do have here at Indian Health Center. And lastly, community focus-based programs. So Indian Health offers outreach, wellness education, and support for chronic conditions and social needs.
That's awesome. It's not every day you think about all the different aspects of IHC's like care that we provide. So it's nice to be reminded about, like you were saying, the culturally relevant care and how it's holistic in its approach. The mind-body aspect of having the behavioral health integration, and then our community focused programs. I think that in San Jose community, that's what we're most known for, because you remember the good things, you remember the fun.
Yeah.
In our IHC like community focused programs. Like we just had one. This episode might release a little bit later in October, but we just recently had our fall gathering, which happens at Roosevelt Community Center. We had like 100-something folks in attendance where we do free food, entertainment. Last time they were playing musical chairs. They were doing the limbo. And it was super fun until the elders got a little feisty in the musical chairs. So that's like some things to keep in mind. And if you are interested in learning a little bit about IHC events, go ahead and check out the link to our event page. We post all of our upcoming events there. We have events that we plan out months in advance. So even if you look at the calendar and say, hey, I'll be in San Jose at this month, you might check our calendar and just see if there's an event or a class that you would like to attend. All of our events are free for the community. The only one that's not is our IHC Laughter is Good Medicine Gala happening November 15th at the Mexican Heritage Plaza. There's a bunch of different ticket options, so if you're interested in attending our gala and supporting IHC community, standing with American Indians, go ahead and check out our link to our IHC gala. You can also look it up on Eventbrite for tickets. Awesome. Well, can you update us on some vaccines that IHC is currently recommending for patients?
Yeah, definitely. This is not my area of expertise. I did have to ask my boss for some guidance on here, so thank you so much, Andrea. Some of the vaccines that IHC is currently recommending to patients is the flu vaccine, RSV, COVID-19, pneumonia, and the shingles vaccines.
Okay, the usual suspects. Yeah. The only one I don't really get to hear too much is shingles. I think that's really good to remind our elder population. The youth can also get shingles. If you've ever had chickenpox, you have that virus in your body. I had shingles at a younger age, and I was like, what is this? Oh. I got told it was because my immune system was really low. I was dealing with a lot of stress. I don't know how that happens as a teenager, but apparently it felt like the world was falling apart and I got shingles on my side.
Oh, wow. I do believe that stress causes your immune system to just get weak, because when I was stressed a few months ago, I was getting sick like every month. So definitely it's important to take care of our bodies.
Of course. And then part of that is that mental health aspect. So if you're going through something, there's always somebody that you can reach out to. At IHC, if you self-identify as American Indian, Alaska Native, or if you're part of a federally recognized tribe, you can always reach out to our behavioral health team. From what I've learned, that there's no barriers for American Indians, Alaska Natives. For other folks, you might be able to reach out to the county. If you are dealing with suicidal ideation or thoughts of that nature, you can also reach out to the number 988 for some support there as well. Yeah, thank you. And are there any new upcoming vaccine recommendations that patients should be aware of as we enter the flu season?
Yeah, since flu season is upon us, or it's going to be upon us, some of the vaccines that IHC is currently recommending is, again, flu vaccine, RSV, COVID, and the pneumonia vaccine.
Yeah, okay. I remember RSV, it's like respiratory, syncytial virus. There we go. Ha-ha! Science.
Got it.
Yeah, so make sure you guys stay up on your vaccines. They're super quick to get. if you set up an appointment, you'll be in and out in about like 5 minutes, fingers crossed. They also do have like flu or like different vaccine clinics. If not at IHC, if you are a patient of, like Kaiser or things like that, they have walk-in appointments for that too. So just make sure you check in with your primary care provider. And if IHC happens to be yours, go ahead and schedule your appointment today. And make sure that when those family gatherings are coming up, I know we have Halloween, we have Thanksgiving, we have the other winter holidays like Christmas. So make sure that when we get into those family gatherings and you're among family who might be a little bit more susceptible to becoming sick because they're an elder or they just have a challenged immune system, that you get these vaccines. They're not for you, they're for the folks around you. So getting a vaccine is being a good community member, a good family member, a good ancestor. So make sure you do that today if you can't, or if you haven't done it already. And how does IHC ensure patients have easy access to the necessary vaccines? And what's that process like for getting vaccinated at IHC, since we're talking about it?
Yeah, definitely. So all of our four clinics offer walk-in immunizations with no appointment needed. We ensure that every patient gets vaccinated without missing an opportunity. So if, like Marissa mentioned, if you are interested in getting vaccinated, not just for yourself, but for your loved ones around you, definitely you can stop by at a clinic for a walk-in.
Awesome. And that's for IHC patients specifically. So if you're already registered with us, go ahead and do that. If you're not, again, reach out to your primary care provider and see what that process is at your local clinic. As a new member yourself, what advice would you give to somebody thinking about joining the IHC team?
Yeah, for someone that's thinking or considering, joining IHC, my advice for them is to embrace the collaborative culture here. It's a supportive environment where teamwork is valued and everyone is dedicated to providing quality care.
Awesome. Thank you so much. I just have some other questions. Nothing crazy, not like about vaccines and whatnot. It's because like today's episode is about health and wellness, like advocacy. So, if you don't mind sharing some things that you do to take care of yourself, what are some things that you do for your own health and wellness?
Things that I like to do for my own health and wellness is I like to go on walks. I have dogs, so that they also give me an excuse to go on walks and just go outside and catch some vitamin D. It's very important. Also getting some exercise. I will say that I have not been doing the best at doing that, but getting some exercise done, whether it's going on a walk, a small hike with your friends, that's always fun. Another thing that I like to do for my mental health is I like to set boundaries. Like if, for example, if I get invited out with friends and I'm just not feeling, socially energized, I like to say no, just to reset my batteries. I think that's very important. And also just like to keep myself surrounded by my loved ones. I think that also helps with my mental health.
Awesome. That's awesome. For myself, like I go on walks with my dogs because, an animal owner, you have to be responsible. You gotta make sure they get their exercise while simultaneously getting your own exercise. So it's been nice. We've been slowly increasing how many miles and how fast we're going per mile.
Oh, nice.
We started like 24 minutes, which is terrible. Like we're not doing a 5K anytime soon. Don't assume that. But then we got up to like 21 minutes and then we got up to 20 and then 19. So it's really cool to see that my dog is ready to run regardless of how tired I am. But I'm slowly getting fast enough for her.
That's
that
good.
makes sense. And then we have been slowly increasing our miles. We started at just like 1 mile, then we got to 2, then we got to 3, and we're aiming for 5. So I will eventually be able to walk a 5K, but like on my own time, So that's super cool to hear that you also have animals and that you're a responsible dog owner. You walk them. Do you take any classes or have you ever been to, see like a trainer or anything like that?
I used to take classes, but I haven't recently. The classes that I used to take were Pilates, and they were really fun and good for breathing. Like they emphasize the breathing section a lot of how you have to incorporate the breathing with the movements. And I also learned that it helps with your posture. So I thought that was very interesting. And it's a really fun exercise to do. It kind of reminds me of yoga. I definitely want to get back into it and try out some other classes. I I want to try yoga, but we'll see.
Yeah, yoga's super fun. I used to think that hot yoga was terrible. Like, never. Why would I want to be hot on purpose and sweaty on purpose? Because I would take yoga classes, like regular ones, and then went to a hot yoga. It is a game changer. Like, you were not, like, for myself, I was not in pain while I was doing the yoga. Like, I usually have, like, tight muscles here and there. And then so when I go to a yoga class in, like, a colder studio, I can feel the difference between that versus hot yoga. And it's not like 100 degrees. It's like 80 degrees.
Yeah.
And if you wear, like, a tank top and shorts, you're fine. You might be a little slippery, but, like, overall, it's okay. And they let you bring water in and towels. And if you need to step out, they also let you do that too.
Oh, that's awesome. I definitely want to look into the hot yoga.
Yeah, so it's like I said, it's a game changer. I thought, never, ever will I do this. But to me, it also kind of reminded me of going to, like, a sweat lodge or even, like, a sauna. You go there to release things, and it helps you, like, loosen up your muscles. So that same concept applies to hot yoga. So if you ever want to try it, go for it. It's super fun. And I just like that I didn't have as much pain as I would normally have, stretching and whatnot. Do you do anything for, like, mental health? Have any what would your ideal, like, mental health day look like?
My ideal mental health day looks like staying home and watching movies and just spending time with my dog, ordering some food in, or cooking a meal, depending if I'm energetic or not. But yeah, just staying home and watching movies with my dogs. I think that's my ideal mental health day, and just resetting my batteries. Those are definitely what my Sundays look like. I like to reset my batteries for the week ahead, and just get mentally prepared for the week.
That's good. I'm glad that you really, like, take time to, like, disconnect and also recharge yourself. That's good and responsible. I sometimes am good at that, sometimes not great at that, and I'll sign myself up for all these events and go do things, but then I come home and I'm like, I need a weekend from a weekend.
No, I totally understand how you feel. I recently went on a trip to Mexico, and when I came back the following weekend, I was like, please don't invite me nowhere, because I need to reset my batteries and I need to catch up on some rest and sleep.
Yeah, and then plus, like, you miss home, and then once you're home, you're like, finally, I'm here. Then I miss, like, you think of vacation and you go and you're like, oh, this is fun and cool and different, but, like, I want my bed, I want my pillow.
It's like you need a vacation from your vacation.
Yes, that is for real. Well, thank you so much for joining us today and sharing a little bit about your health and wellness, like, routine for yourself and what that looks like. If you folks, the listeners, if you don't have a routine for yourself, you know, you can put in the comments something that you try to do to make sure that you maintain your health and wellness, whether it's physical, whether it's mental, anything that, or spiritual. I know folks who are getting closer to their indigenous roots, and they started going to ceremony, and just how healing that's been for them. So, you know, if that's something that you are looking to reconnect to, reach out to myself at marketing@ihcscv.org, and we can go ahead and connect you with those resources in the community.
Thank you so much for having me, Marissa. It was an honor. Thank you.
Yeah, thank you for joining me. And I know it takes a little bit of courage to kind of get out there and talk and be on camera, so I appreciate your time.
Thank you.
Yeah. So some upcoming events that IHC has are our IHC Laughter is Good Medicine Gala. It's a fundraiser for the American Indian Alaska Native community. If you attend this event, you're helping us fundraise to make sure that we can continue providing quality comprehensive care for our community, as well as providing behavioral health and prevention services to underserved youth. So stand with IHC today and go ahead and get your tickets with us. You can check out a little bit more information about that on our Eventbrite page or the IHC events page. To stay up to date, check out indianhealthcenter.org/events. Thank you so much for listening. Don't forget to rate, review, and subscribe. If you like our content, check out our Instagram, Facebook, YouTube. Our handle is IHC San Jose. Thank you.
Thank you. Bye.